Hello, everyone. My name is Lakin Radica, and I'll be giving a presentation today on oral health and prevention. I'll be speaking on behalf of the Public Health Club from the University of Colorado School of Dental Medicine. So with that, we can go ahead and get started here. Well, as I mentioned, this is going to be a presentation on oral health. So we kind of need to go ahead and define that term first. And I'll be adding to this definition just as we're going throughout this entire PowerPoint. So oral health is quite simply put, it is keeping your gums and teeth healthy and strong. And so with that, we want to go ahead and, why is oral health even important? Why do we want to keep our teeth healthy and strong? And it's because it can go ahead and assist in everyday functions. So we have to imagine our teeth and our gums and what make up our mouth is going to help us in eating. So things like crushing, grinding, and being able to chew or pierce through food starts that digestive process. That's the very first portion of where we can go ahead and start converting food into energy. So it's obviously important being able to eat, and that reiterates why it's important to maintain healthy, strong teeth and gums. Also, we have appearance. So our teeth are going to play a role in how our smile looks. Also, our teeth play a role in how our face is shaped. And then lastly, we can even talk about speaking. So things like our teeth, tongue, cheeks, and lips, they all go ahead and play an important role in making sure that we can go ahead and pronounce certain words and make certain sounds with our mouth. So with that said, that's why oral health is important. So we have to kind of talk about, what to watch for in terms of what's going to inhibit our oral health. So something, what we call a acid attack. So we kind of have to define that term as well. So an acid attack is basically whenever you're eating and drinking throughout your everyday life, and this is a continual process, eating and drinking certain foods can alter the acidity of your mouth. Now, having a higher acidic environment inside your mouth, that is what can kickstart this process of losing tooth structure. So we'll talk about cavities in a little bit, but losing tooth structure is basically where your tooth is decaying. So it starts in the outer surface, and it is that acid environment that can go ahead and kickstart this process. So it's something that we want to look for in order to not have so many exposures. But also with that said, eating and drinking happens every day. So these acid attacks or these acid exposures to your teeth, it's very minimal at that time of that certain beverage or that certain meal. But it's important to note that this is going to be happening continually throughout your entire life. So this is all coming back to the idea of why oral health is important. It's a process to continue throughout your entire life because we're going to always have these exposures of acid as we're eating. So we need to constantly be thinking about, oral health throughout all of our stages throughout our life. So piggybacking off of that, just as acid attack can start to cause a loss of tooth structure, we also have what is called cavities. And so let's go ahead and talk about what can cause cavities. So cavities are a multi-step process that destroys healthy tooth structure, similar to just how we said acid can do that. And acid is actually one of the causes of cavities. We can see here, we also can talk about how sugars, so sugars that we're eating in our everyday life, any type of sugary beverages, chips, crackers, things like that, all gets converted down into sugars, and those sugars become fuel for oral bacteria. So oral bacteria, it's important to note that is always present in your mouth. And it's actually there for a reason, and it's completely normal. Not all bacteria is necessarily bad. And so, but when we are supplying all these sugars to these bacteria, those bacteria can start using them as fuel for themselves. And in turn, those bacteria start to make an even more acidic environment on our tooth. And once again, having that acidic attack where it's more acid on your tooth structure or tooth surface, that's when we can start having decay of that area. So once again, cavities are a multi-step process. As you can see on this diagram over here, we kind of have three different components that are taking place. So we have our sugars, we have our teeth, and we have our bacteria. When we have all of those together, it makes for an environment that we can start creating caries, and that is just another word for cavities. So once again, it's a multi-step process and it takes time. That's another important portion of this is time. So once again, having oral health in the back of your mind throughout your entire life is going to help with prevention of cavities. So kind of going in a little bit more specifics, we're going to talk about managing oral health and kind of more targeted toward pregnancy or during pregnancy or during parenthood. So kind of the first topic we want to discuss is that cavities can be passed from mother to child. It's something we call that is transmissible. So basically being able to understand that if the mother or caregiver has poor oral health, those traits can be passed on to the child, and the cavities can actually be passed on to the child. Also, the American Dental Association, or ADA, states that dental treatment is safe during any stage of pregnancy. So this is even including our anesthesia or our numbing shots. So these are when we're doing certain procedures, we can go ahead and give the patient a shot that kind of just alleviates pain during the procedure, makes it a little bit more comfortable. And these are deemed safe during all stages of pregnancy. And also a really big takeaway from this is that x-rays are even safe during pregnancy. Important to note that we even have safeguards in place and precautions when we're taking x-rays. Things like we put on a gown so that it eliminates the amount of exposure or amount of radiation that the patient is receiving. But with all these safeguards and the minimal amount of radiation exposure you're getting during a dental x-ray, the ADA is saying that it is very important and even recommended during all stages of pregnancy. And also on this slide, we kind of want to talk about finding a dental home and the importance of that. So let's just kind of define a dental home, just very generally speaking. This is just referring to, do you have a place or a dental office that you can continually receive care? So you can probably understand now, I've said a couple times, oral health is a continual process throughout your entire life. So with that, you want to find a dental office or a dental home that you can receive continual care. Some place that you consistently go and have checkups at, the recommended 6 months, getting a cleaning, something that you can take your child in at, just as their first teeth are starting to show through their gums. Being able to have that dental home is going to make it a lot easier, and it is extremely beneficial when we're talking about oral health. So it's just that, do you have access to finding a consistent dental office and having that dentist being able to provide recommendations? And we'll kind of keep talking about that as we're moving along in the slides as well. So moving along, we also want to talk about fluoride. So fluoride is an element, and it actually, the impact of fluoride, what it does is it actually strengthens and hardens our teeth. So when we were discussing acid attacks and the development of cavities, once again, we had that acid come onto our tooth, we had the bacteria, we had the time, and all of those make for decaying of our tooth structure. When we go ahead and add fluoride to our tooth, either by direct application or if fluoride is available in drinking water and things like that, that fluoride gets incorporated into our teeth and it actually strengthens the teeth. Now, what that does is it makes it a lot harder for all of those acid attacks and all of those bacteria and all those cavities to start developing. It makes it much harder and it's less prone to decay. So that's why fluoride is very beneficial for us. It's going to create stronger, harder teeth. With that said, we have to kind of talk about something called fluorosis. So fluorosis is an outcome of when we have a high fluoride exposure when our teeth are developing. So it's important to note that this means during baby tooth development and also adult tooth development. So during those developmental stages, we don't want a high exposure to fluoride because you can cause what's called fluorosis. And that's not going to necessarily damage the teeth or make them weaker or anything like that. It still is going to strengthen the teeth, but it can start to discolor them. And obviously that's going back to our appearance. That's going to change our appearance of our teeth. It's not something we want. So important to note, just during developmental stages of those teeth, we kind of back off the fluoride. And the ADA, or American Dental Association, also supports the fluoridation of community water sources. So this is where another area where we can get fluoride in our tap water. And it is at a very low and safe concentration. And like I said, the ADA supports it and is even recommended. And so with that, we can also talk about just another application of how we can receive fluoride. So one was by tap water or certain water sources, and the other is by fluoride varnish. So fluoride varnish is basically a jelly that dentist or your dental office or even your dental home can go ahead and paint directly on the teeth. And it is actually recommended by the ADA to have fluoride varnish placed on all infant erupting teeth. And so this is just going to be a higher concentration of fluoride put directly onto the tooth to really ensure that it's getting fluoride to start incorporating into that tooth structure, once again, to just strengthen that tooth and also harden it. So now kind of talking about childhood and managing oral health. So when it comes to cleaning your baby's teeth, it's actually sooner than the better. So starting at birth, parents can start massaging their child's gum with a soft toothbrush, a washcloth, and water. So something to really make note here is that it's a soft toothbrush. We don't want any hard bristles. We don't want anything that is going to cause irritation to the gums. What we're really doing here is just taking either that soft toothbrush or even just your bare finger or even just a wet washcloth, and you can just rub that along the child's gum, just massaging that area. And just is kind of stimulating that area. Can also kind of relieve any pain or tenderness if the child is experiencing that. Kind of bringing us to our next point. So from the age of 6 months to 3 years, the child might have tender gums, and that's perfectly normal. It's just during when those first baby teeth are coming through the gums and starting to erupt, it can kind of just cause a little bit of irritation and a little bit of tenderness. So once again, coming back with a wet washcloth, massaging the area, even something that you could use a cold spoon. It's important to say that, the spoon, don't think that it's something frozen or anything like that. It's really just, putting that spoon under cold water or even just in the fridge for a couple minutes. Nothing too cold that's going to cause any irritation of the gums as you're massaging that area. Now, also with talking about managing oral health, dentists can recommend at-home treatment. So this is kind of coming back to the idea of having a dental home. As a parent, do you have a dental home where you can bring your child to consistently and they can get recommendations from the dentist? So these home treatments, when added to regular dental visits, can go ahead and help maintain oral health for the child during their entire lifetime. And so that's really important to note that a lot of these preventative measures, or a lot of these that we're going to be recommending, it's on the child, it's on the parent, it's on the caregiver to be implementing these treatments at home. So regularly brushing their teeth, making sure you're eating a healthy, balanced diet, regularly flossing, things like that. It's really important. It's also important just to be looking for any changes in a child's teeth. So these changes are things like changes in color, roughness, or any irregularities that you think aren't normal. These are something that you can bring to your dental home. Having that continual care, being able to reach out to that office and say, hey, I noticed something, could come in for a checkup. It's really important to have that connection between the family and the dental home. It's also important to note that the baby's teeth is not specifically supposed to just be pure white. It's not. That's not necessarily normal either. So just watching for changes in color, changes in roughness. That's what we're really looking for, and because it's those changes that we can go ahead and bring attention to. Moving on, so we're going to be talking about just some preventative measures, how we can go ahead and stop things like acid attacks, and how we can go ahead and stop cavities from forming. So first, we kind of want to talk about just some facts. So dental cavities are a lifelong disease, as we've been kind of talking about the entire uh, presentation. This is a lifelong process. It's a continuous exposure to different acids. So it's a continuous uh, thing that we need to keep watching with oral health. So dental cavities are the most common chronic childhood disease, and it's actually affecting 37% of baby teeth and has many potential severe consequences. So some of these consequences can be things like pain, um, inadequate chewing and nutrition. So coming back to, if the patient is having pain, child experiencing pain, or uh, they can't go ahead and chew properly, therefore they're not getting the right nutrition and they're not growing. So it's all really a systemic problem. And then going on to even a more severe case is having poor oral health can cause infections and things. So just some other facts to note: students with dental pain are more likely to have a lower grade point average, and children with poor oral health are more likely to miss school as a result of dental pain. So this is just coming back to how important it is to be monitoring oral health and how it can affect a child having such severe pain. Now this slide is really just for your own knowledge. It's just something that you can reference back to. It is a slide illustrating different times that your teeth or your baby teeth should be erupting. So as you can see, just kind of explaining how to use this chart. So you can see here we have our central incisors, and these are your two front teeth. And just following over, these are your central incisors here. And we're just kind of talking about when we should be expecting these teeth to start erupting or coming to the gums. Now, I'm not going to go through all these dates. It's just kind of more for your own knowledge to reference back to, but you can also note that these are not set in stone dates. It's nothing to be freaking out about if your children's front teeth are coming in between 8 and 12 months. It's nothing set in stone. These are really just recommendations. So once again, just kind of looking for what's normal and seeing any changes or differences from that normal is something to watch. And once again, bringing that to your dental home if you have any concerns at that time. So now we're going to talk about home care and just some equipment that we have. So obviously with brushing, we have soft bristle toothbrushes. That's really important, soft bristles. We don't want anything that's too hard. You don't want to be applying too much pressure when we are brushing the teeth. You don't want to be irritating any of that tissue. So soft bristles, also electric toothbrushes are good. They even have songs or lights built in that help the child know that they're brushing for 2 minutes, or even the caregiver. So brushing twice a day for at least 2 minutes is really important. Also, just some helpful tips. Thicker handles are typically easier for a child to hold. They have little hands, so a lot of baby-specific toothbrushes are going to have bigger handles. So just something that is a little bit easier to use as you're kind of transitioning the child into brushing their own teeth. And then also brushing the tongue is really important. Make note that you don't want to be brushing too far back to where there's any type of gagging. But brushing your tongue is really important too, just for clearing some of that bacteria in the mouth as well, and also for bad breath. And then we have flossing. So flossing can be technique sensitive, but if you just kind of follow these simple rules, so really what you want to do is when you take a floss, you want to get a pretty long piece out, and you're going to be wrapping it between one of your fingers on both hands. And you're going to be placing that floss in between the teeth. And once it's in between the teeth, you want to go ahead and pull that floss and create a C shape to hug around the tooth that you are going to be flossing at that time. Once you're hugging that tooth with the C shape, you're going to be going in an up and down motion, kind of going down to the gum line and then back up, and do that maybe about 3 to 4 times. Then you can go ahead and pull out and go to the next tooth. So that's kind of proper flossing, making sure there's a C shape or hugging around that tooth in an up and down motion. Now, we can also talk about how flossing is actually not necessary until the teeth are starting to contact. Once those teeth contact, that's when the toothbrush bristles can no longer get in between the teeth and the sides of the teeth. So that's why we want to get that floss in there, create that C shape, hug around the tooth, and just really making sure that we're getting that surface of the tooth. So once again, upon contact, once the teeth are starting to come together, that's when we want to start to incorporate flossing into your at-home care. Just some other helpful habits, kind of as we already mentioned, brushing twice a day for at least 2 minutes. Um, and this should start just as you're starting to see the teeth emerge. So just as you were kind of massaging the gums with a wet washcloth or your finger before the teeth are erupting, now you can, as the teeth are coming out of the gums, you can start brushing twice a day for 2 minutes. As the child is less than 3 years old, we will actually use a very small amount of toothpaste. So we recommend a rice-size amount for children 3 years and younger. So a very small amount, you do much. And then as they are getting older, these are rough estimates. So as they're getting 3 years and older, we recommend a pea size. So once again, still a pretty small amount. And also we want to recommend that the caregiver should be brushing the child's teeth typically until they're around ages 8 to 9. And this is just to ensure that the child has developed certain hand skills. Once again, just being able to hold that toothbrush can be a challenge for some children. Being able to get the right angle on the toothbrush, the motions of the brushing, these are all things you kind of need to develop hand skills for. So we recommend that the caregiver be doing the toothbrushing just until that child can develop those skills on their own. And then also the child should spit out the toothpaste after the brushing, but make sure that the child does not rinse. So there's no need to rinse your mouth with any water or anything like that, because that's just going to wash away some fluoride that was in the toothpaste. And once again, we want that fluoride to stay on our tooth surface so it can go ahead and start strengthening and hardening our teeth. And we're just going to mention again, flossing starts once the teeth are beginning to touch each other. Also want to note that there should be no food or drink after brushing and flossing. So brushing and flossing should be the last thing you do before bed. They shouldn't be having milk or any type of juice after they've brushed because when you're going to bed, you want to make sure that all your teeth are clean and free of all those sugars and all that acid as they're falling asleep. So just make sure that brushing is kind of the last thing they do before bed. And then also, we want to make a habit of watching out for sugary medications. So some medications, as we know, can be pretty bad tasting. So what companies do is they add sugar to them, make them a little bit sweeter for children to be able to handle them or take them orally or by mouth. And so some of those sugars can have a pretty high content of sugar. So we want to just kind of be conscious and just watch out for sugary medications. Once again, making sure you're not taking that sugary medication after you've already brushed and after the child is ready for bed. Just important to watch out for. And here's some just other good habits. Again, brushing twice a day for 2 minutes, drinking fluoride tap water, just having that fluoride exposure helps strengthen and harden your teeth. And just gonna list some low cavity risk foods. So as we mentioned earlier, all that acid attacks food. As you eat and drink certain foods, it changes the acidity of your mouth, and that goes and starts the process of tooth decay. But some foods are actually good and neutral and don't cause any acid changes in your mouth. So things like fruit and veggies, cheese and crackers, pretzels, popcorn, nuts, plain milk and water. These are all really healthy, balanced snacks that dentists could recommend, and what we would say are low cavity risk snacks. Now with that, we kind of have to talk about the bad as well. So avoid giving bottles at bedtime. This is coming back to the fact of you want brushing to be the last thing that the child does before bed, just so they, all of that acid and all the sugars are cleaned out of the mouth before bed or nap time. And so there's something that is called bottle syndrome. So we really want to recommend that we aren't giving babies or children bottles as they're going to bed or taking nap time, because sometimes if they fall asleep with that bottle in their mouth, or even having that milk or juice in their mouth and it's just kind of sitting there and pooling in their mouth, it's all that sugar and all that acid that is just sitting there, being able to basically start taking away tooth structure and start that cavity process. So it's really important. Don't let the child just sit with a bottle. Just kind of keep monitoring that, and definitely don't be giving the child the bottle as they're trying to fall asleep. We also want to recommend that we limit juices in the first year of life. This is just, once again, during that developmental stages. We don't want a lot of high sugar in the mouth as teeth are developing. And some high risk snacks for cavities would be things that are really high in sugar. So cookies, cupcakes, treats, any type of gummies and cereals, granola bars, sugary drinks, sodas, and iced tea. These are all things that just have high sugar content, which is going to obviously be bad in terms of developing cavities. Also, we want to recommend avoid frequent snacking. So if we are recommending, 3 meals a day, breakfast, lunch, and dinner, something else to note is that having snacks in between each one of those meals is, once again, gonna expose the teeth to more sugars at each snack time. So if we're limiting our frequency of snacking, it's limiting the exposure of these sugars. And that's something that we want to do, is just if we have less exposure throughout the day, it's going ahead and make it more probable that we can maintain oral health throughout our entire life. Now we're going to just kind of talk about dental visits, what is going to be taking place at your dental home. So your child should see a dentist when the first tooth appears or at their first birthday. Now, once again, this is also just a recommendation. So, if the child's a year and a half and you still haven't been to a dental office or a dental visit, it's nothing to worry about. It's just a recommendation, once again, so that dental home can just be monitoring the teeth and give any recommendations that the dentist sees. Also, early visits to the dental office is a way to make your child more comfortable. So just having that early exposure, seeing mom, seeing dad, seeing the caregiver or brother and sister in the dental chair getting work done, and it's just going ahead and create a positive influence on that child. So it's going to make it easier later on when that child starts to come in for more regular visits. They are already comfortable with the dental office, and there's no anxiety, there's no fear, and it just makes it a lot easier transition for the child. So just as a way to motivate and have the child take responsibility for their own healthy smile. And that's really important too, is making sure the child understands why things are important and why they should be maintaining oral health. And also, we have to talk about home care. So I think we talked a little bit earlier how these dentists are going to be, or dental offices will be able to give you recommendations, but it's really on the caregiver, the parent, and the child to be actually implementing and doing all of these treatments that the dentist is recommending. So it's doing the brushing and flossing twice a day, and looking for any changes of the tooth, things like that. So it really is a lot on getting your regular checkups, and then day-to-day oral health regimen is going to be on the family. So that is all that we have today. If you have any questions, feel free to reach out, and I hope you guys enjoyed the presentation. Thank you very much.